During the TMJ examination, you identify that the person has limited opening and or lateral deviation restriction. It's important to be able to identify how well the joint is moving and whether the restriction is actually articular or non-articular. We're going to be examining the joint, and also we'll use the same techniques that we use for examination for glide as we would for treatment as well. As well, we're looking at the difference between articular versus non-articular, as you would with any joint, to determine whether or not it's a capsular problem or it's a non-capsular problem, such as with muscle. So what we're going to do is we're going to first take a look and see how well the jaw will distract. And I'm going to be taking the lower part of the jaw, the mandible, into a posterior and inferior glide position. I'm going to be going intraorally, so I'm going to use a glove and I'm going to place my thumb on the lower molars. As I come in here, we have to make sure that we have enough room to be able to get in with our hand comfortably. And I'm going to come in on the back of the molar, and my hand and my finger are going to come around the mandible. And I'm going to control the mandible with my lateral three fingers and my index finger over the articular eminence. I'm going to take the jaw and I'm going to move it posterior and inferior, which is at 90 degrees to the articular eminence, and just get a sense of how well that feels and whether or not I feel glide or it feels like a hard end feel. After I've done that, I'm going to get a sense of whether or not there is glide available for opening. The glide for opening is going to be one that comes anterior, inferior, and then also lateral. The anterior and inferior are going to come together. So I'm going to place my thumb on the molars again. I'm going to bring the mandible forward, anterior and slightly inferior, and get a sense of whether or not there is glide available or it's a firm end feel or harder end feel. And then I'm going to come onto the inside of the molar. I'm going to take the molar and I'm going to try and apply a lateral glide to the TMJ as I do that. Palpating with my left hand to get a sense of motion. And then come out. So if the right side does not, it seems to be opening well, the left side may be the one that doesn't close well or go posterior, medial, and superior. So we're going to check that out as well. And so we'll come again onto this left side, see whether or not I can get the glide available going posteriorly and superiorly. And then for the medial glide, I'm just going to take my hand and I'm just going to slightly pronate as I do the superior and posterior glide and do that medial glide to try and get that end feel to see if it's there, or if it feels like it does move, it's a firm end feel. If there's glide available, it's probably not the joint. If the glide feels like it's firm and it's hard, then we probably would say this is one that needs to be mobilized. After examination of the medial side, looking at the closing on that TMJ, you may be interested to look for one more thing, and this is the hamulus, which is a bone off the pterygoid tubercle. And what you'll be doing is coming into the upper molars, and they're going straight up and back and feeling for a bone and feeling for a tubercle that you'll be springing with your index finger. If it feels springy, then the problem is probably within the TMJ. If it feels hard, then we probably want to think about a component of the craniovertebral region as being the problem where we need to examine for next. So I'm going to come into the upper molars, look for that hamulus, which is that firm component on the pterygoid plate. See if I can spring it, and in this case I can spring it, but if it was hard, I'd go to the craniovertebral region, but since it had spring to it, I'm going to stay with the TMJ and treat the TMJ.